Hey guys, this is Dr. Tonya, and today I want to talk about something that's really close to my heart. You see, as someone who has fought breast cancer and who still continues to help others fight cancer every day, I know there's a lot of talk out there about different treatment options. So today I want to show you how you can mix regular medical treatments with some other really cool types of treatments that might help too. You see, it's not about choosing one treatment over another. It's about combining them both to see how you can make your treatment even stronger. So let's dive in and see how you can fight your cancer using both in your own way. Hey guys, it's Dr. Tonya. So today I'm going to be talking about 3 different groups of therapies that can be used to treat cancer. Those 3 groups include standard of care therapy, it's first group, alternative therapy, second group, and complementary therapies, which is the third group. But before I talk about any of that, I want to give you just a real quick brief history about who I am, just in case this is your first time seeing me or tuning into this channel. I'm Dr. Tonya. I am a board certified radiation oncologist. I have been treating cancer patients for over 27 years. And at the same time, I am also a 9-year breast cancer survivor. I was diagnosed with a triple negative breast cancer that was treated with removal of both of my breasts and reconstruction. I received 6 months worth of chemotherapy with 3 different chemotherapy drugs. And then I also received 6 weeks of external beam radiation treatments that I received daily for 6 weeks. So I am coming to you both as an oncologist and as a fellow survivor. And I have used some of the complementary techniques that we're also going to be talking about as well. Because my goal for you today is to not only get well, is that I want you to be well and stay well. So I am coming to you from that standpoint. So let's dive in and talk about standard of care treatment. So standard of care treatment is what's going to be recommended to you by your oncologist. So when you're first diagnosed with cancer, you're going to see an oncologist or a team of oncologists. And they're going to recommend a treatment course for you. It may involve chemotherapy, radiation therapy, surgery, immunotherapy, or even all of them. So that is what's considered standard of care therapy. A standard of care therapy is not some therapy that they just pulled out of the air. It's therapy that has been tested on thousands of patients that have a cancer just like yours, same stage as yours. And they have determined that this recommended course of treatment is a treatment that is going to give you the best outcome with the least amount of side effects for the cancer that you have. So that is why that recommendation has been made. Now, the second type of treatment that we're going to talk about is alternative therapy. So this is therapies that people choose to treat cancer instead of the recommended standard of care treatment. Now, alternative therapies are typically some type of either nutritional therapy or herbal remedy that is given to treat cancer in lieu of taking the standard of care therapy. Now, these types of treatments, alternative therapies, don't undergo the same rigorous testing that standard of care therapy has undergone. So for me, as a trained oncologist, I cannot, in good faith, recommend an alternative treatment instead of a standard of care treatment. Now, the next group of treatments that I'm going to talk about are complementary therapies. Complementary therapies are things that can be used along with standard of care therapies. They're not meant to be standalone treatments. Now, complementary therapies tend to reduce side effects, help aid in anxiety, and just really help the treatment work better, help your body get stronger so that you can withstand the treatment better. So I'm going to talk about 4 different complementary medicine techniques that I recommend that patients use along with standard of care therapy. Now, the first one that I want to recommend, and personally for me, I think is the most important, is prayer. Because prayer for me has been wonderful. God really does answer prayers. And I would recommend that you ask God to make sure that he puts you in the right hands. Not every doctor was meant to treat every patient. You want to be in hands that are anointed to treat you for your condition. Someone who is able to communicate effectively with you. Someone who has good bedside manner, who makes this process comfortable for you. You know, if you're in a situation where that is not the case, then I would be in prayer to make sure that God finds that person for you, because that is an important part of getting through your treatment, is being in a place where you feel comfortable. The second type of complementary medicine that I want to talk about is meditation and relaxation. That is so important because it is so important for you to reduce your stress level. Having cancer and undergoing cancer treatment is stressful. So when you can add things that reduce your stress level and reduce your anxiety level, that's going to emotionally make you feel better. And physiologically, the effects that it has on your body is going to reduce your blood sugar. And from what I found out since completing my cancer treatment is that cancer can metabolize sugar faster than other energy sources. So you don't want to have any excess sugar around. And when you decrease your stress level, your stress hormones goes down and your blood sugar also goes down. So that's going to reduce the amount of sugar available in your body for your cancer to use to grow. So someone with active cancer in their body, you want your blood sugar to stay low. So you don't want to do things that are going to increase your blood sugar. So you want things that are going to reduce your stress. Something that you can add also that's going to reduce your stress is music. Music has been shown to be a great stress reliever. Music by itself works well, but combining music with the guided meditation and relaxation works even better. You're going to get that same physiologic benefit in your body. It's going to reduce your stress hormones, in turn reducing your blood sugar, making that sugar less available for cancer to use for energy and growth. Third thing that I would recommend is that you work with a cancer nutritionist who is trained in low-carb nutrition to create a meal plan for you that is low in sugar, that will not only reduce the substrate for cancer you use for growth, but also help relieve side effects from some of your treatments. And then the last thing that I would recommend is exercise. Exercise has been shown to significantly reduce the amount of fatigue, especially for radiation treatments. And it's also been shown to help the radiation work better. And exercise also helps with your mood. It's going to get those endorphins going, so to help you have more joy as you're going through this process. So I would recommend one standard of care treatment, at least trying it. You know, definitely you never know if something's going to work if you never start it. You can always stop a treatment if it proves to be too toxic or has too many side effects for you. But if you never start it, you never know if it's going to work. And I have seen so many cases of people who have opted to do alternative treatment in lieu of standard of care medicine, and for things to go sour very quickly. You know, they may get a short response of the cancer to the alternative therapy, only for it to rebound and for them to present to me for treatment at a point in their treatment where their cancer is no longer curable. And at that point, all I can do is help make them comfortable. So I don't want that to be anyone's story. You know, always I recommend start off with the treatment that has been recommended, because you can always start something that you start, but you'll never know if it's going to work. And I don't ever want anybody to second guess whether or not their cancer could have been cured if they opted to do something else. But then I would add one of the complementary techniques that I just talked about to help make your body stronger, help the cancer work better, help relieve any anxiety, and help you get through this process better. You can choose one or even all of the different therapies that I talked about to help your cancer, help you get through cancer treatment better. So hopefully this was helpful. If so, please like this video, please share this video, and subscribe to this channel to keep getting information like this. I will see you guys in the next video. Talk to you later.